Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. Some of you recognize this anatomy, right? Today we're going to be discussing the vagina pathology. This is covered in your book, Medical School Pathology and Step 1 Review. You can scan the QR code to get to the updated material. Vagina pathology. As we all know, the vagina is the canal that leads to the cervix, right? Have you done a speculum exam, right? You remember that, looking at the cervix, maybe spraying it with vinegar, right? The vagina is lined by non-keratinizing squamous epithelium. And specific vagina pathology that you must know includes lichen sclerosis, extramammary Paget disease, adenosis, clear cell adenocarcinoma, embryonal rhabdomyosarcoma, and obviously vaginal carcinoma and vulvar carcinoma. And we're going to talk about all of it, starting with lichen sclerosis. Now, this is a familiar condition because it can show up in other locations. Lichen sclerosis is a benign skin condition that often affects the female genital region. Lichen sclerosis appears as wrinkly, white, thin skin. Kind of like flaky paper-like. Symptoms of lichen sclerosis include pain, ouch, irritation, and itching. Lichen sclerosis is a risk factor. This is important. It's a risk factor for vulvar carcinoma. And here we have an image showing lichen sclerosis. Now let's talk a bit about extramammary Paget disease. Extramammary Paget disease is characterized by the presence of malignant epithelial cells in the vulva's epidermis. This is some important histology that you will definitely see in the future. Take a look at this. Note those abnormal cells migrating towards the top of the screen, right? Those are the Paget cells. Symptoms of extramammary Paget disease include redness, right? It'll be erythematous, itchy, might even notice some ulceration of the vulvar skin, okay? Extramammary Paget disease represents a carcinoma in situ, which is typically a surface cancer. And here is that classic histology of extramammary Paget disease. When you see this, you want to make sure to rule out melanoma. So S100 would be negative, melanA would be negative, HMB45 would be negative. And here is some more histologic and gross pictures showcasing Paget's disease. Now let's talk about another commonly tested entity for sure, adenosis, right? Adenosis is due to concentrated columnar epithelium persistence in the upper third of the vagina. During development, the columnar epithelial lining of the upper 1/3 of the vagina is derived from the Mullerian ducts, right? Remember that from embryology? The squamous epithelium is from the lower 2/3 of the vagina, and that is derived from the urogenital sinus. There is increased occurrence of adenosis in females exposed to diethylstilbestrol, DES, while they are pregnant or were pregnant, like in utero. In regards to another commonly tested entity, for sure you should be able to recognize clear cell adenocarcinoma. Clear cell adenocarcinoma is a malignant proliferation of glands with clear cytoplasm, hence the name. To the right here, we could see cytologic features of malignant glands in A, and in B, we can see the tumor involving the serosa and some irregular glands. This is actually gastric outlet obstruction due to adenocarcinoma in a patient with ataxia telangiectasia. Just kind of tying in together the glandular features that may be present. But keep in mind that clear cell adenocarcinoma is a complication of DES-related vaginal adenosis. And the use of diethylstilbestrol was discontinued as a result of the discovery of this consequence and other DES-related abnormalities of the gynecologic tract, such as irregular uterine shape. Now here's another important condition known as embryonal rhabdomyosarcoma. Now in embryonal rhabdomyosarcoma, which is malignant, there's mesenchymal growth involving the malignant muscle cells. Now take a look at this histology to the right here. This is embryonal rhabdomyosarcoma, consisting almost entirely of differentiated rhabdomyoblasts. And this is a word that should ring bells. Sarcoma botryoides, right? And that is a specific type of embryonal rhabdomyosarcoma. So don't get confused. Sarcoma botryoides presents as a bleeding grape-like mass that protrudes from the vagina. And the histology of sarcoma botryoides has a distinctive cell called the rhabdomyoblast that has cytoplasmic cross striations and is immunohistochemically stained positively for desmin and myogenin. You might be asked those. So desmin and myogenin, remember those. And here we have a gross representation from a surgery that just happened of a radical trachelectomy. And this is a completely excised embryonal rhabdomyosarcoma that can be observed in this specimen. Now, vaginal carcinoma. The squamous epithelium that lines the vaginal mucosa can develop into cancer, as we can see here to the right on this micrograph of mucinous adenocarcinoma. Vaginal carcinoma is typically associated with high-risk HPV, right? And do you remember any of those high-risk HPV? You should. Right? 33 ring a bell, 35. What about 6 and 11, right? Those are low risk, right? 6 and 11. Anyway, you will be asked those. Now, vaginal intraepithelial neoplasia is the precursor lesion of vaginal carcinoma. And when local lymph nodes are affected, cancer from the bottom 2/3 of the vagina spreads. Vaginal carcinoma from the lower third travels to the regional iliac nodes, and cancer from the inguinal nodes. Here we can see that multiple partners and an early age of sexual contact are risk factors connected to HPV exposure, which typically affects women of the reproductive age, later on leading to vulvar carcinoma. Vulvar carcinoma arises from vulvar intraepithelial neoplasia. Remember that. And vulvar intraepithelial neoplasia is a dysplastic precursor lesion to vulvar carcinoma with abnormal nuclear atypia, coilocytic alteration, and enhanced mitotic activity. The most frequent cause of non-HPV associated vulvar cancer, which you should know, is chronic lichen sclerosis. Burn that into your memory. Chronic inflammation and irritation subsequently results in carcinoma. And importantly, from an epidemiologic perspective, vulvar carcinoma is typically observed in older women, with the mean age being greater than 70 years old. Sorry, Grandma! And with that, you've completed another very important presentation. Hats off to you. You're doing such a great job. If you have any questions, comments, or concerns, let me know. And make sure you don't forget those HPV subtypes, the ones that are more worrisome and the ones that are not, right? And until next time, keep up the good fight. See you later.